Hi, this is Janie recording. We have Noor as our patient, Nina as our support person, Kyle as our nurse, and Liliana as our doctor. We're presenting hypokalemia for 102 theory.
Are you okay? Okay, just take it slow. Just take it slow. Okay, Mom. Where's the nurse? Oh gosh, where's the nurse?
Hello, knock knock. Hi, I'm nurse. Are you okay, Mrs. Stokes?
Can you help her?
Sure, let's lower this bed. Whoa, whoa, oh, right, you're puking. Come on, can you sit up on the bed?
I'll try.
There you go, good job. Mrs. Stokes, is that right? Is this Miss Stokes?
Yes.
What's your relation to Mrs.
Yeah,
Stokes?
this is my mom.
What's wrong? What's wrong with
She's been sick for a few days and we don't know. Mom,
How are you feeling, Mrs. Stokes?
on the bed, okay?
Are you feeling okay?
She's been throwing up and
Here, can you hold on to this? If you're gonna spew, spew into this. So, Mrs. Stokes, can you tell me how you're feeling today?
not so good.
How are you feeling?
Stomach hurts. She's been throwing up for the past 2 or 3 days.
Have you been throwing up a lot, Mrs. Stokes?
I guess so. And I tried to give her water and she won't drink any of it.
Okay, well, I'm gonna listen to your heart, Mrs. Stokes, and then we're gonna do a couple tests before the doctor comes and see you, okay?
What kind of test?
Well, I want to listen to her heart. We're going to do some labs on her so we can get some, check her electrolyte levels.
Okay.
And we're going to see what's the cause of her sickness. If she's throwing up a lot, if she's losing a lot of body water, then maybe she could be dehydrated or losing some of her electrolytes that she might need. So I'm going to cover you up, Mrs. Stokes, because you might be cold.
I'm cold.
Okay, so I'm going to cover you up. Here's your blanket.
Can I raise the head of the bed?
Fortunately, sure, Mrs. Stokes. Okay, I'm going to listen to your heart, okay, Mrs. Stokes? I'm going to reach under here with my scope.
Why is she breathing like that? Oh, you're cold.
I'm going to check your skin here. You look a little dry. Your eyes look a little dark and sunken in, so you're probably dehydrated. So
What is that?
that means you don't have enough fluid in your body, Mrs. Stokes. Have you been drinking any water recently?
Am I going to die? No, she hasn't drank any water.
How about your diet, Mrs. Stokes? What's your diet been recently? What have you been eating?
I like chips.
Do you like chips? Do you drink any? How much water? Do you don't drink very much water? Or do you like?
It's nasty. I like soda.
You drink soda? Are you on any type of medications, Mrs. Stokes?
Yes, but I can't remember. She's on digoxin.
Digoxin?
Yeah.
Okay. So if she's not drinking any fluids or water, and she's on digoxin for her heart, which I listened to was a little weak and thready, she's probably dehydrated. So what we'll do is see, if we can get some lab results. Her diets might be a little weak, so she might need to intake some better electrolytes, like depending on what the labs say, maybe There you go. Can you sit up?
Is she gonna be okay?
Sure. Okay, so what I'm going to do is I'm going to do a couple more tests, and then I'm going to get our doctor in here. So, Mrs. Stokes, what I'm going to do is I want to take your blood pressure, okay? Because I want to see where it's at. So
Kyle's going to take orthostatic blood pressures with the patient lying, sitting, and standing if she's able, as well as temperature, respirations, pulse, and oxygen saturation.
I know, you're gonna feel better soon.
Okay, so I'm going to take your blood pressure again with you sitting up. Can you sit up for me?
I'll help you sit up, Mom.
So Kyle's completed his orthostatic blood pressures, and Dr. Liliana is coming into the room with lab results to further discuss with Kyle
Come in, Doc.
and the patient.
Hi, Nora. How are you doing? I'm the doctor, Liliana.
No bien, doctor. El estómago, el dolor mucho.
So Kyle, how is she doing?
Well, she's obviously very weak and very dizzy. She's complained about some cramps and aches. She's got some nausea, vomit, and diarrhea. She's got chills and sweating. She's reported she's on digoxin. She said that her diet hasn't been very well, just chips and soda, and she doesn't drink very much water. I did a few tests. I checked a few different blood pressures, her sitting down, laying down, and when she stands up, and she has a lot of orthostatic hypertension, so she wants to immediately fall over when she stands up. And the blood pressure is very weak, 85/50. She's got a high pulse at 110, which is weak and thready, and her respirations are pretty shallow but high at 22. So she has also deep tendon reflexes, which is pretty excitable as well.
Okay, well, we're gonna order some labs and see what's going on, all right? And I'll be back.
So labs have been ordered, blood has been drawn, and the doctor and the nurse return to discuss the results with the patient.
Hi, Ms. Stokes. We're back.
So
What's going on?
the lab results show that your potassium levels are really low. Normal is 3.5 to 5, around there, and yours came out 2.8. So what I'm gonna do now is order some IV potassium and some saline and some Phenergan to reduce your nausea and vomiting, and some Imodium for the diarrhea. Okay.
And what I'm going to do, Mrs. Stokes, is I'm going to kind of tell you about what these numbers and things mean. Are you familiar with your potassium level or what potassium
No,
is?
I
does?
don't understand why my potassium is really low.
So
I don't get it.
So your body needs potassium in order for your muscles and everything to work properly. And if you don't have enough of it inside of you, then you're going to be lethargic, sick, nausea. And so what?
Can I eat potassium?
Well, lots of rich foods have potassium,
And we're
Mrs.
gonna give you
Stokes.
some IV potassium.
And that's what I'm here to tell you about.
And you're gonna have to stay in the hospital until your potassium is
What
Yes,
about
Mom,
my
it's turned in
vomiting and diarrhea?
Yeah,
It's
well, that's
nasty.
Yes, we order some
nasty.
Phenergan, and that will help with the nausea and vomiting. So that should stop with that medicine.
So what I want to show you, Mrs. Stokes, is this is what you're on, digoxin. That's for your heart arrhythmias, but what it causes is your potassium levels to be low. So what you want to do is you want to eat more potassium, Mrs. Stokes, like bananas, some fish, some also other
Banana
good
is
foods.
nasty. It's
She doesn't like
nasty.
bananas.
Well, there's all kinds of other good foods that have potassium, Mrs. Stokes. So I'll give you a good list of other
Tastes
things
like
that have.
poop.
Well, you can have raisins or potatoes or bran flakes or wheat. So, and also coconut water, which is delicious. So, if you don't have enough potassium in, you can be hypokalemic and you can die.
No.
But that's not going to happen to you, Mrs. Stokes, because we're going to take good care of you. So, what has potassium? Bananas.
Ew, that's nasty.
But there's other things too, like raisins or potatoes or wheat and other delicious
How
things
about
that
my
you can eat.
headache, dog? I'm having headache. I need something for my headache.
So, Mrs. Stokes, again, what we're going to do is keep an eye on your potassium levels and make sure you're getting the right fluids inside your body. Enough water,
Okay.
no more sodas, no more chips. Also, when
That's
you're
so
taking your
harsh.
digoxin medicine too, make sure you listen, do some heart rate stuff before you take it.
So the doctor's orders were carried out. Our patient's potassium levels were raised. She was rehydrated and released the next day.